This is the ICL procedure, the implantable contact lens. We start off by making two very tiny incisions in the eye. This procedure is done while the patient's awake, but the eye is fully anesthetized. The patient feels nothing and sees nothing. You'll notice that these incisions have a tiny amount of bleeding. That's important. I'll tell you why. Here's more anesthetic that's placed inside the eye. This is for patient comfort. Again, though the patient's awake, they see nothing and they feel absolutely nothing. A little bit of a jelly substance is put in the eye. This is a special protective substance to protect the delicate intraocular structures. Now, when we make our main incision, we're going to use a gem quality diamond, and it makes this very tiny incision, less than 1/8 of an inch in size. Again, you'll note that I like to barely nick these tiny blood vessels at the periphery. The total amount of blood you see here is very minuscule. It's all less than 1 drop. But because I have that tiny amount of bleeding there, these incisions seal very quickly and very strongly. This is all done for patient safety. Now it's time to place the ICL in the eye. The implantable contact lenses are very thin. You'll notice that most surgeons place the ICL in the eye and then use a lot of manipulation in the eye to put it into proper position. We've eliminated that problem. I can now implant the lens completely in the eye in its correct position, all by the way I inject it in the eye. You'll see the lens comes out slowly. It's rolled up like a carpet. Now, the 4 corners must be tucked. The first corner in the upper right is tucked properly under the iris. Perfect. Now the second corner in the upper left also goes under the iris. The first half of the lens is well positioned. Now for the trailing 2 corners, we'll use the injector in such a manner that both of those will automatically be tucked in their proper position. This eliminates all of the manipulation that is used by most other surgeons to position the lens. The manipulation can cause inflammation in the eye, it can cause a cataract formation, or it can even cause damage to the gentle ICL lens itself. These are new instruments I've designed from Storz. The Storz company is owned by Bausch & Lomb, and these instruments are to remove that jelly substance from the eye. In my right hand here, I have an infusion that places special saline in the eye, and on my left hand, a vacuum device that helps me remove all that jelly from the eye. Any little remnant of jelly or air bubble is of no consequence because it's naturally washed out by the eye itself within the course of a couple of hours. I like a nice thorough cleanup here, and of course we can remove that tiny little air bubble. The lens is already in perfect position. It's well centered, all 4 corners are in the correct orientation and location, and there is no need for further manipulation. I like to put an additional medicine in the eye. This is a medicine called Myocol, and what it does is it brings the pupil back down to a normal size. The pupil constricts to its normal size, and you can see the beautiful centration of the ICL. That looks perfect. Now to seal the incisions, we just use the same saline solution, and I can put a little solution here at the incisions to seal them shut. There's no sutures or anything else. Immediately after the procedure, the patient starts to recover vision.